Okay, it is February 19, 2019, and I'm in Nagasaki. Cindy Kelly, Atomic Heritage Foundation, and I would like to have my guest say his full name and spell it.
My name is Masao Tomonaga, honorary director of Japanese Red Cross Nagasaki Atomic Bomb Hospital. And I have one of young atomic bomb survivors, 2 years old at the time of bombing. So later I will explain how I was exposed to atomic bombing. Shall I start my
Yes, please.
talk? Now, the title of my talk is The Long-Term Consequence of Atomic Bombings in Hiroshima and Nagasaki, Evidence of Anti-Humanitarian Aspect of Nuclear Weapons. Maybe you know very well about the details of the bombs, that is Little Boy and Fat Man, and casualty for Hiroshima and Nagasaki. Maybe you know very well also. I don't explain anymore. Usually I will explain in this way. Only 64 kilograms of uranium detonated, but actually 850 to 900 grams detonated to destroy whole of Hiroshima. That is equivalent to 16 kiloton uranium. And in case of Nagasaki bombing, 21 kiloton plutonium was used. That is equivalent 10 kilogram in plutonium, pure plutonium, and actually 1 kilogram detonated. Such a small amount of detonation expelled Nagasaki and Hiroshima cities. So this is a photograph taken by U.S. Air Force a few days before atomic bombing. That was August 9. The original target was here. And my home was located about 1 kilometer from original target, but actual target changed to this point about 2 kilometers north of original one. And the next photographs explain how this Nagasaki northern part was destroyed completely. You can see here ground zero, and my house was about 2.5 kilometers from the ground zero at this point. Okay, and these areas were actually military arsenals areas of Mitsubishi arsenals, and also Mitsubishi shipyards are located here, and they were completely destroyed. And my alma mater medical school was located inside 1 kilometer range from the ground zero. This is the old buildings of Nagasaki Medical University Hospital, totally destroyed. Later I talk more detail. And this area was surrounded by about 300-meter hills and mountains. So the inside this area was almost all buildings except for this gigantic hospitals destroyed, more than 90% of. And you can see over there are ruins of arsenals. So death rate according to the distance from ground zero were calculated within 3 months after bombing by surviving professors and medical students of Nagasaki University Hospital. They calculated about 6,000 interviews, based on the 6,000 interviews. They found amazingly, death rate was very low, only in university hospital. That was due to heavy shielding by concrete, thick concrete buildings. So blast wind reached over 3 kilometers, and the red area shows the 100% complete destruction of buildings. Of course, our university hospital was inside 1 kilometer range. This is hypocenter, ground zero. And my house was located about 2.5, about this area. And military arsenals are located along this big river. So this is a real site where I was exposed to atomic bombing. Here you see a Catholic church, the second largest church in Nagasaki City. This was almost completely destroyed, and my house was a wooden house. All areas are full of Japanese wooden house, so they were crushed completely or partially. And then within 10 to 15 minutes, a huge firestorm came to my house also. So I was sleeping on the second floor of this wooden house, and my mother was working for preparing lunch in the first floor. She quickly came up to my room on the second floor. She said I was sleeping on the bed because I was ill. The day before atomic bombing day, August 9, I suffered from tonsillitis and high fever. So she took me to University Hospital, August 8, that was August 8, one day before 9, almost same o'clock, around 11. So I was sleeping in the bed. And she took me out of the broken houses. Not the firestorm has not reached yet, so she could take me out of the broken house, and she escaped from this area to nearby shrine and spent one night. So we are completely safe at the time of bombing. We are a lucky family. Okay. You have some question?
And where was your father?
My father was not in Nagasaki. He was serving for Japanese Army Air Force in Taiwan. He was his troops stationed in Taiwan, south of Taiwan.
I see.
He was an army doctor belonging to Army Air Force in Taiwan. And there he heard about the news, complete destruction of Nagasaki City. So he said to us, he once thought his family all perished. But later, maybe within 1 month, my mother's letter safely reached him, and he got the news that we are alive. So, but he was ordered by Chiang Kai-shek army government in Taiwan to stay in Taiwan more and to serve Taiwanese people for medical care. So he stayed there 1.5 years. Then he came back to Nagasaki. So we met in Nagasaki 1944. 1947, 2 years later. He left Nagasaki in 1942 after graduation from this medical school. Okay. So within 1 kilometer distance from the ground zero, the situation was terrible. Many carbonized bodies were seen, and also white bones were seen. Carbonization occurred by the strong heat rays from the detonation, direct. So those people were walking on the street was directly exposed to heat rays. But later they were body were burned again by the firestorms, then became white ones. Some books wrote atomic bomb energy evaporated human bodies directly to white bones. This might be not correct in terms of physical power of heat rays. Heat rays has not so huge energy to make human body evaporate. Okay, you understand? Yeah. Evaporation is instantaneous destruction of all organs or deep organs, but this was not true. Maybe I suspect that black boys inside his body still organs are existing, but later if he were born burned by firestorm, his body become only white bones. Okay.
His body would become ashes?
Ashes,
yeah.
Sometimes ashes.
Right.
Yeah,
destroyed.
Almost within 500 meters, the bones became ashes. So you can just take ashes.
Right, right. But that's different from evaporation.
Yeah. Dr. Nagai wrote this scene when he found his wife's bones in the ruin of his previous house. He said he couldn't take bones, just ash on his hand. So he wrote, "My wife was escaped from my fingers." So the right upper side photograph shows the most severe total skin burns. Maybe he was facing to the explosion directly and exposed to heat rays. So heat rays destroy our very thick skins, maybe 3 centimeter, 4 centimeter thick, all over the bodies, directly. Deep this skin layers. So the skin began to peeling off, and bleeding and the pain. This is a terrible situation. Even our skin of arms hanging down. So they almost all of them walked like this, if they were alive, still alive. Most of them died sooner or later. Okay, and those two bodies, babies and mothers. This is also instantaneous death. And left side, you see also black carbonized bodies. Probably mother, she found, daughter found her mother. So again, the black boy, and the right side, upper side, shows a dead and agonizing survivors or fairly well looking survivors, a mixture of such people. This is the photographs taken on the second day by Mr. Yamahata, the second day. That means there's no photographs showing the first day scenes of Nagasaki bombing. In Hiroshima, there are 2 or 3 photographs. There are only 3 photographs. Later, I'll show you. Okay. And this red back boy, famous boy, was 16 years old, and he was riding on a bicycle to deliver letters, postman. He was a postman, a 16-year-old, and burned directly from the back. And he was naked, unfortunately. He was naked at that time because of the summertime, too hot. So he was naked, only with pants. Then his skin was all destroyed and peeled off. Later he could survive, and this man, age 80, he became a very famous atomic bomb eradication activist, Mr. Taniguchi. Maybe you heard his name once or twice. And his skin recovered after 2 years, and as you see here, there is a shining skin, but this is not real skin. This is a scar tissues. So he could not sweat. He could not have a soft skin with oily texture. He was always suffering from dry skins, especially in summertime. It was a terrible time for him because his back, entire back, could not sweat. So he was always sitting in front of the fan or air conditioners. So within 2 weeks, people who are exposed to atomic bomb radiation rays began to show hair falling. This is called, in medical term, epilation. This girl also had complete epilation. That means their bodies were deeply irradiated by atomic bomb rays. That is consisting of gamma rays and neutron rays, two major radioactive rays. That radiation reached almost 2.5 kilometers. You remember, my house was located about 2.5. So I might have been exposed to the smallest amount of radiation. During the early pregnancy, the fetus were exposed also to radiation, and those boys showed microcephaly, small head boys and girls. Maybe around 100 such babies were born from direct survivors, mother who were pregnant. So this is the second showing, and you may see on the second day, no rescue teams arrived at this point. Rescue team, medical rescue team, I mean. So almost all medical facilities, especially the largest medical facilities were Nagasaki University Hospital, were destroyed. And although 45% of doctors and students survived, but medical facilities, and including drugs and blood transfusions, all gone. So there was no rescue on the second day. So there was no hospital in the atomic field. So nearby elementary school, half destroyed by the blast wind, began to be used for ambulant places for medical care, but there was no meaningful medical care at the point, only supplying water, foods, and so on. and many people died in this ambulant elementary school. There was no burning system of dead bodies, so these playgrounds of the elementary school were used for this burning dead bodies. So the situation was terrible. This is the boy who agonizing and died within a few days after this photographing, showing subcutaneous skin bleeding. This was a typical sign of bone marrow destruction. You know, bone marrow, this is normal bone marrow, and this is such a heavily irradiated people's bone marrow autopsy tissue photograph. There was no blood cells being made, so platelets that prevent the bleeding became almost zero. Then their capillaries and small vessels began to bleed spontaneously. So they die. And also those photographs show hair falling. So inside deep body bone marrow, and this is intestine, large intestine, or mucosal membrane were destroyed by the heavy radiation. Okay, so the death rate curve were later calculated as showing H Hiroshima and Nagasaki, and two curves a little bit different at this point, at this range, almost overlapped like this. At my point, 2.5 kilometers, the death rate was around below 5%. Mostly they were died in broken Japanese houses. They could not escape from the broken houses and were burned by the firestorm. Okay, but within 1 kilometer, death rate goes up from 80% to over 95%. Very high. So this is normal colon. You can see many pores, and so the surface of the colon mucosa is very wide and can absorb enough water and nutrients. But severely burned colon shows no pores, and all mucosal cells were destroyed. Okay, bone marrow also destroyed like this. So the agonizing period ended within 3 months. So after 3 months, survivors became fairly well in early 1946. But in 1947 to 48, survivors faced a very surprising phenomenon of increasing number of acute leukemia among especially small children and later adults. So within 1.5 kilometers, the curves rapidly elevated, maybe 10 times or more compared to the normal population, non-exposed population. Leukemia is a disease which occurs very rarely among healthy people. That is control rate. And middle distance areas shows a little bit lower, but within 1.5 kilometers, that means heavy radiation shows a very rapid increase of incidence per 100,000 per year. Very high rate persisted almost 15 years, then declined gradually. But this was not the disappearance of atomic bomb irradiation. Okay. So this is the total results until the present time, 2018. The first risk of leukemia appeared like this and declined. But later, the solid cancer phase began and continues until now, until now 73 years after bombing. So most of the survivors who are suffering from cancers at this time, age over 73, when they were very young at the time of bombing, less than 10 years old. Now getting older and older, but still suffering from solid cancer, and also another type of leukemia called MDS. So this figure clearly proves that atomic bomb radiation effect on human bodies is real lifelong effect. And also very scientific data is this. About 80,000 survivors were calculated for their exposure dose based on the US Army data, and so they have individual dosimetry, individual dose, and the leukemia excess cases appear like this, depending on the dose they were exposed. This is not a linear curve, but we call it quadratic curve. This is a curve for whole solid cancers. Different from leukemia, this curve is linear. We don't know yet know why leukemia curve and the cancer curve is different. Maybe some difference in the mechanism of cancer induction at the molecular level, gene level. That means gene level. Recently, we are facing a very dangerous situation. It is a multi-cancer occurrence among short distance survivors. This is almost three times higher among 1.5 kilometer shorter survivors. In my hospital, atomic bomb hospital, this is the present situation, still in 2018. And this is the second type of leukemia called myelodysplastic syndrome. This is amazingly showing linear response curves. So quite different from the first leukemia data. Maybe some difference in leukemogenesis after almost 70 years, more than half century. So there are still unsolved problem to understand how radiation-induced leukemia and cancers in human bodies. So specialists must explain why atomic bomb radiation effect is such a long-lasting one. We are now trying to explain. There is a stem cell in our organs. Stem cell can continue to live whole human lives and producing mature functioning organ cells. Please consider bone marrow. Bone marrow has stem cells, and they are providing mature red cells, white cells, and platelets. So those stem cells might be irradiated in 1945 and recovered once for almost entire life of survivor, but still they are carrying damage induced by radiation. So someday this is this induced stem cell changing into cancer stem cells. Okay, this is our hypothesis now. Maybe I believe this is maybe true. Actually, we can sometimes observe chromosome damage in white cells and red cells. The same chromosomes abnormalities between two different cells, but this means the stem cells common to these white cells and red cells might have been directly hit by atomic bomb radiation. These chromosome aberrations goes up like linearly, like cancer and leukemia. Radiation dose is more and more higher. The cytogenetic abnormality, chromosome abnormalities, right, go up. So healthy atomic bomb survivors have white cells and red cells carrying chromosome abnormality, even now, after 70 years. And in addition to body effect, we have long seen psychological damage to survivors. This young lady was one of 7 brothers and sisters that survived. Only she could survive, and had a keloid formation on her face, and the skin looks fairly well now, but these are not real normal skin, scars. So by using WHO General Health Questionnaire, we found dose-dependent increase of depression and PTSD, post-traumatic stress diseases, the rate increased like this. So in conclusion, the atomic bombs are gene-targeting weapon. The radiation immediately causes DNA damage. That causes immediate death and also later induced leukemia cancers during survivor's entire life. The psychological effect is also long-lasting and profound. My next part of talk is if 16 kiloton Hiroshima-sized bomb were detonated on the modern city at the present time, how many deaths and cancer and leukemia we will observe? This is a simulation study recently done by Hiroshima Nagasaki specialists. This was a study designed, planned by Japanese Ministry of Foreign Affairs 3 years ago. This is a very important photographs on the first day of Hiroshima. Over there you see firestones. So those people escaped from the nearby ground zero to this distant point, but all were burned, and still only a few people were standing. So we have so few photographs. So many survivors wrote their own experience inside or burning conditions like this. So the reality of atomic bombing on the first minutes or hours, 1 hour, were fire. They were all fired. Human body began to fire also. And also, this is my case. I was captured by the broken house, but my mother could safely took me out of the house, but this mother couldn't. Those babies died. So such a scene was often observed by surviving people. And even school children were following teacher, all burned, but I think they will die sooner or later. This lady is no more working. And small rescue teams are entered Hiroshima, but it was not enough for so many suffering people. So complete destruction of city infrastructure, both in Hiroshima and Nagasaki, and the occurrence of leukemia and cancers. We can calculate the total number of leukemia within 2.2 kilometers. That means 2 gray in radiation dose, and 2,709, 2,211 cases were observed, and 88% of those cases were actually radiation induced, and 61% of those cases were 10% were actually a radiation dose, but 2 gray, shorter distance, maybe over 60% were induced actually atomic bomb radiation. So this was the base for our simulation studies. We simulated hydrogen bomb explosion, 1 megaton bomb, and the 16 kiloton bomb. This is Hiroshima size, and 4.5 kilometer diameter area was destroyed. And in case of this is smallest hydrogen bomb actually, 18 kilometers smallest. So this is Hiroshima city size, and this is 36 kilometer in total area. So this is a 16 kiloton case. Heat, radiation, how much reached. This is hydrogen bomb, 18 kilometer diameter. But the strange calculation is this: radiation cannot reach over 3 kilometers because radiation cannot reach to the ground from very high altitude, 2,400 meters. So radiation cannot this distance spreading. So as a result, our calculation indicated that first 1 megaton hydrogen bomb killed direct instantaneously 370,000, and immediate injury for 46. But in the modern buildings, buildings were strong, but those survivors inside the buildings will be injured by very thick. As you know, modern buildings were covered with glasses, so broken glasses kill most of those people. At the Trade Center attack, many people rushed down to escape from the falling buildings, but in those cases, those people once reached to the ground level, but the ground is full of cars firing, so they cannot escape safely. So those people are mostly the final death rate. Okay. So radiation affected people is larger in 6 kiloton atomic bomb, 555,000. Instead, in contrast, 1 megaton, smaller population, so smaller number of leukemia and the cancer cases. This is curious, but our actual simulation. So the atomic bomb caused rapid destruction of the population in one city. This is Hiroshima case. It took 30 years for Hiroshima to recover the city population, 30 years. So this is only one detonation. In case of nuclear wars, more than 100 or a few hundred nuclear warheads were exchanged, so the situation terrible. The summary of studies according to our experience of 2 atomic bombs and the results of study to estimate nuclear damage based on the real data to a large modern city. We admit severe humanitarian impact of nuclear weapons. Nuclear weapons should not be produced anymore, should never be used again, and ultimately abandoned forever. I must talk I forgot one point. This data is the first data of the occurrence of leukemia among atomic bomb survivors in Hiroshima and Nagasaki. This is my father's paper, first appeared. And this was adopted in the textbook of leukemia by Dr. Dameshek and Gans, United States hematologists. This is the first. So my father returned from the battlefield of Taiwan and returned to hospital. So his classmate was almost all gone. So he was very young, but he was appointed as an assistant professor to teach medical students. And he studied the after effect of atomic bomb bombing among survivors, and he first encountered this occurrence of leukemia. At this years, Dr. Nagai was writing Battle of Nagasaki, but he was suffering from leukemia because of his long medical practice as a radiologist. So he has been exposed to excess radiation by medical examination, because in wartime we have no X-ray films, so they were used direct observation of, for example, tuberculosis examination. Every day he examined a few hundred school children by directly examining. Okay, this is all right. Must be treated. So he developed leukemia 5 months before atomic bombing. So he has a huge spleen enlargement, and but he was working on the atomic bomb days, but he cut his carotid artery directly, and severe bleeding started. But the professor of surgery tried to give him a small operation to stop bleeding within a few minutes after bombing. So, but Dr. Nagai recovered very well, and he worked for survivors for 2 weeks. Later, again, this bleeding restarted. But this was also overcome, and he began to write his experience. That was appeared in his book, Battle of Nagasaki. And my father returned to Nagasaki 1.5 years later, after atomic bombing, and he found his senior Dr. Nagai was suffering leukemia. My father was appointed as attending physician for Dr. Nagai, and later he treated 3 years Dr. Nagai, and Dr. Nagai died finally, age 46. And my father sometimes took me to Dr. Nagai's rooms, and we talked. Yeah, I remember him clearly.
Yeah. One last thing, you might just say a minute about what you're doing with atomic survivors now, your work with the clinic, the nursing homes.
Yes, nursing home. My nursing home, 400 survivors were being cared. Some of them has no relatives remaining to care them, so we are caring. And Catholic missions work. This is Catholic mission work So every day about 30, 40 survivors, they are very old, almost for 80 years or more, suffer from, for example, in this season, influenza and some common diseases. So I must take care of them, to treat them, yeah. But they are fairly well now. No direct consequence of atomic bombing cannot be seen easily. They look very healthy. But still, they have, if we examine their white cells, red cell, for chromosome abnormalities, they show some abnormalities still. Skin is also some abnormalities. So they are having like a bomb inside body. So if they finally develop cancer, for example, breast cancer, colon cancer, most of them say, doctor, in our body, atomic bomb was living, still living. That is a common saying from them, yeah. So their whole life was psychologically and very depressed for a long time, almost 70 years, 80 years. They suffer from real depressions, sometimes real depression. And especially in summertime, beginning June, July, their psychological condition deteriorates. And if they passed the August 9, their psychological situation gradually improves every day. So their memory of their dead families, like ladies, continues for whole lives.
Do they talk about this experience with their other people in the nursing home, or is that something they do not like to talk about?
Yeah, if we ask each of those survivors, they talk very in detail about their experience. But recently, it is evident they are losing their memory of atom bombing very rapidly. So for them, it is very hard to repeat their experience. We have a record about for one survivor, 20 years ago when she entered the home, nursing home. The details shrinking. Atomic bomb memories are shrinking along with the aging.
Right.
Some of them are suffering actually dementia.
Yeah.
Dementia. So dementia is maybe relieving their anxiety and depressive feeling about atomic bombing gradually.
Right.
So they are becoming just aging
Right.
elderly.
Yeah.